Hello, I'm Brian Bennett. I'm Time Magazine's senior White House correspondent. Welcome to my home office in this time of social distancing. We're now going to welcome Senator Klobuchar. He's been senator for the state of Minnesota for 13 years. Hi, Senator Klobuchar. Great to see you.
Good to
as I was
see
saying,
you.
former presidential candidate. Where are you now? Tell us what your setup is here.
Well, I'm in my home office in Minnesota and with my family. My husband's with me. As you know, he got over the coronavirus after a really scary time in the hospital, and he's doing really well now. And it really taught me a lot about what these families are going through right now and what you just showed of those ordinary people doing extraordinary things. You know, it's those nurses and doctors that are holding up the phones to your loved ones because you can't go in and hold their hands, and then you can't even hug the people taking care of them. And it's one of the hardest things about this disease. So I really appreciate you showing their faces, sometimes behind masks, but all of the incredible work they're doing at the front line, because that's what saved his life.
How's your husband's recovery going since he got out of the hospital?
Well, it's actually going pretty well. It was about on the fifth day in the hospital, he took a good turn and his oxygen levels improved. And then he's only 52, so it shows and healthy that it can happen to anyone. So then he recovered in Washington, and then when he got better, we came to Minnesota. And the only lasting thing is when I tried to get him to clean the basement yesterday, it was like, oh, you don't want to get any dust. So I guess that's a lasting effect.
So what was it like to not be able to be with him when he was going through the worst parts of having the virus?
Well, I think as you've heard from so many people, I think it's hit almost every family. And by the way, my love and thoughts are with my friend Elizabeth Warren today, who lost her brother. He died. And it just shows, again, anywhere, any place in the country. And it's not just urban areas, it's moving into rural areas. And for me, I just wanted to be there. You're so used to visiting people when they're in the hospital because you want to be at their side, and it allows you to figure out more what's going on. And in my case, I talked to, of course, the doctors and nurses, but then I relied on him. And he had a really high temperature for 10 days, over 100 degrees. And it was really hard to figure out what was going on. And so remembering, I know for everyone, that you have to be so extraordinarily patient because you've got doctors and nurses that have so many patients that they're dealing with. And so that was one of the things. I couldn't believe it. I finally got all their names because I've never been able to meet them. And I'm writing them notes, personal notes to thank them. And my husband, though, now he's really feeling good because he has these super immunity. So he's just gave blood. Went down to Mayo Clinic and gave his plasma, which they're really hoping is going to help people who get sick.
We're also writing letters in our house. My 8-year-old son has been writing letters to family members and friends who are healthcare workers on the front lines. You have pressing work that you're doing in the Senate. We'll get to that in a moment, but there's an election going on. And I was wondering, how are you balancing social distancing and the needs of retail politics going forward? Biden is running for president. He was your former political rival. Will you be out there stumping for Biden? What are your thoughts on that?
Well, I am, but it's, of course, in a whole different world, a whole different way. And one of the amazing things about Vice President Biden is just how he can always relate to people from his own personal tragedies that he lived through, losing his wife and kids, but also just everything he's done in the world. And I know from my own experience when he helped one of my friends once when she had lost her husband. That's what he's about. And so he's been doing it from his own house, just like every other elected official. I've been helping him virtually. We're doing events. I'm doing a Women for Biden event tonight, of course, by Zoom. And we're also doing a number of things. We did his podcast, and you just keep campaigning in a different way. And we don't know what course this will take in the fall, what the conventions will look like, but the issues are there. We've got the issue of what happened with this administration, and which there'll be many, many moments and debates, whether they're virtual or not, to go through exactly what went wrong and why we weren't more prepared as a country. But right now, as you're doing today, we are talking a lot about how we go forward. And a lot of that has to do with testing and being smart about following the guidelines state by state. We've got so many governors that have been leading. And for me, our governor's doing a great job here in Minnesota, Tim Walz, and we've been working together. And we just rolled out a major testing effort with the University of Minnesota and Mayo Clinic to help the people in Minnesota so we can get more and more people tested so we can eventually get our economy back again.
When you were on Biden's podcast, he called you his great friend. Did you guys have a conversation? Have you had a conversation about being on his short list for vice president?
No, actually, when I decided to end my campaign after about a year, and I started in a blizzard, as you remember, in Minnesota, and ended at this joyous rally with him in Dallas. And I couldn't think of a better way to end it. And I never talked to him about it at all. I knew it was the right thing to do. I wanted to unify our party. And since then, you've seen both my friends Bernie Sanders and Elizabeth Warren endorse him, as well as President Obama. And so to me, this is the united front right now. And that's where we are. And I never had any talks about him about any of that, because for me, what's important is winning this election.
If Biden asked you to be his running mate, will you say yes?
I am not engaging in hypotheticals, because right now we have this, just as you are talking about with all these incredible guests today, we've got to deal with this pandemic, and we've got to do it as quickly as possible, both with the immediate, with getting those workers that you've shown the equipment and getting the testing out, the short term, which is slowly but surely and smartly helping our businesses and moving to get our economy and our workers. And then in the long term, something I've been working on, our democracy and some of the long-term effects we're going to see going into next year, making sure the money is being spent wisely, that the government gives out, and that there's accountability, and also making sure that we are employing people again.
Yeah, let's turn to your work in the Senate. You helped get $400 million for safer voting measures in the congressional package in March. Explain what's that money going to go to? What steps are being taken to make sure Americans can vote safely in November? What's that look like?
Yeah, well, this is really exciting because I think everyone remembers that scene of the people of Wisconsin standing in line in homemade masks and garbage bags just to risk their lives, basically. There's well,
it looks like we're going to wait for the feed to come back up on the senator's feed there. We heard a lot from her about things that she plans to do. We have a lot of questions to ask her about what's happening right now in the Senate. Right now, she has been pushing for more money to encourage vote by mail, which would be important. Trump has criticized that. Here, you're back. Welcome back. And let's go to Trump's criticism of mail-in voting. Some of the money that you push for to be in that package would go to increase mail-in balloting. Tell us about that and whether Trump would try to interfere with that.
Well, he's not for this right now, but there's sure a bunch of Republican governors that want to encourage it, including in New Hampshire and in Maryland and Ohio and other places. The idea is simple: expand voting at home, make it easier for everyone to do it. Also make it easier so the polls are open for, say, 20 days before an election, so you don't have people congregating. And again, that's seen in Wisconsin, people in their garbage bags and homemade masks, standing in line while the president was able to order his ballot up by mail from Palm Beach, Florida. We can't have that happen again. And Ron Wyden and I have been leading this effort in the Senate. We were able to get, as you said, $400 million in the first bill, but we'd like to get well over $2 billion. That's what it's going to need for the postage, the envelopes, and it's going to happen. We're already having so many citizens request these mail-in ballots because they know it's safer in the primaries, and then it's going to happen again in the general election. And people should not have to choose between voting and their safety. And just to show how nonpartisan this has been, some of the leading states for mail-in ballots are states like blue states like Oregon, but also purple states like Colorado. Utah, a pretty Republican state, is one of the leading states for mailing in ballots. Arizona is one of the leading states. And so we're seeing state by state citizens pushing to break down some of the barriers, like giving an excuse to get one of those ballots. 16 states still have that. You've seen 2 Republican governors waive the need for those excuses. There's something going on across this land, which we saw at its best in those voters in Wisconsin. They were mad. They were mad that the Republican legislature literally played politics with their lives, and they voted big. And I think my colleagues have seen that. So I'm very hopeful we'll be able to get funding and some of these reforms in place in the next major piece of legislation that comes out federally.
How concerned are you about political interference into public health decisions right now? At HHS right now, the former head of BARDA, Rick Bright, was shunted aside. He says he was shunted aside because he's pushing back on funding for the malaria drug and treatment of COVID. What are your concerns right now about the decisions that are being made inside the administration?
Major. You have not just him being pushed aside, which is just brutal, since he is a doctor and someone that was simply trying to look at the science and look at the facts and do what's right. But then you also had the Inspector General who had been chosen on a nonpartisan basis to lead the effort to examine how this money's being spent. And that is someone who had been literally through the Bush administration, the Obama administration, had served as the Inspector General for the Justice Department. And
so we'll have Senator Klobuchar come right back. She's just frozen just a moment, and her feed will come right back. I'm going to be asking her some more about McConnell's statements today about funding for. All right, come on, Senator Klobuchar, if you can hear me.
We're back. I'm back.
Fantastic. So we were just talking about any concerns you might have about political interference in public health decisions. Do you think there's going to be enough testing available for people to feel safe to open back up in Minnesota and other places?
I don't think we have that now by any means. And it has really bothered me that this president at the Republican convention said the words, "I alone can fix this." Then when we're in this major crisis of unprecedented dimensions, decides, and people's lives are on the line, literally says, "Oh, I'm in the back seat for the governors." Well, yeah, the governors should decide when their economy's open, but we should have a national testing strategy and a national vaccine strategy. And there is no way you can replicate that one state by one state by one state. I can't even imagine some of our smaller states being stuck with trying to figure out how they're going to develop a vaccine or develop the testing that we need. And but right now, we saw so much time being lost when the tests weren't allowed to be developed like they should. And that should be a national strategy. We were able to obtain the Democrats in the Senate $25 billion. We held our ground, wouldn't make an agreement till we got that for testing so that can be sent out across the country, because we're not going to be able to bring people back unless we have some kind of testing regime and know that it is under control and know who has immunities, that's serum testing and the like. That's what we need to do this. And we're starting to see that in some countries like Germany, where they're in much better situation because of their testing regime.
You've called for the USDA to establish a rural COVID-19 task force. I'd love to hear you talk a little bit about how you see the needs of small towns being different from the needs of big cities in this epidemic. And I'm also wondering, do you see bipartisan behavior in Congress right now? And does that give you hope for getting things done in the future?
There is, or we wouldn't have been able to reach that agreement. And obviously, the president continues to play politics with this every day, finds a new issue that will divide people. But there was agreement to get that bill done. And one of the overlooked factors here are rural areas. Predominantly African American rural area, the town of Albany, Georgia, was hit really hard. Some of our highest per capita death rates in my state and incidences of cases per capita are some of our rural counties. And we're starting to see it, especially in our senior homes, state by state by state. Needs are very unique. An older population, less health care closely available, less ventilators. You've got a population that doesn't have as good a broadband in many cases. So the distant learning is hard. I just was on with some of our high schools in our rural areas hearing that same thing. And so we have to make sure it's not one size fits all, and we have to start paying attention. Number one goal would be to have a president with consistent messaging, which we haven't had, to say, you know what, it knows no limits. It hits rural areas. It hits our farm communities. And I'd end with that. We have 2 of our major pork processing plants closed because there wasn't planning ahead when it came to inspections and standards. And we also are starting to see problems in our food supply, people waiting in line for food shelves because there isn't enough food. That's the last thing we need to have happen. So we're really focused on putting that through as a rural strategy to make sure that we are, again, bringing the testing out there and getting the food to the people that need it.
Thank you very much for joining us, Senator Klobuchar. It's been a good discussion. I wish you all the best of luck going forward. And I hope that you and your family stay healthy and safe.
Well, we will, and we'll improve our internet service every day. Maybe.
All right. Thank you very much. Good to see you. And coming up next, my colleague, Edward Felsenthal, will welcome back John Legend at our first ever TIME100 Talks. It will be the final interview, and there will be a special closing performance. So stick around for that. It's going to be great.